it and then it's active. Yeah.
Good afternoon, everyone. Thank you very much for joining us. We welcome you to this session, whether you're joining us here in person, and we are so happy that you are, or virtually. My name is Tim Leshin. I'm the Chief External Relations and Advocacy Officer for the Association of Schools and Programs of Public Health, ASPPH. Today, we'll embark on an engaging discussion for the next hour, exploring the crucial role of academic public health in forming strategic and impactful community partnerships. We're here today at the University of North Texas Health Science Center, School of Public Health. Sorry for messing that up. Here in Texas. It's one of I've been to Texas before, but I've never been here to Fort Worth, so it's great to be here. And I really want to thank Dean Shafik Dharamsi for hosting us here and being our host. And for all the great work, I want to recognize all the great work he and his team here at the School of Public Health are doing in the community. So after some brief presentations, our panel will discuss not only the theoretical framework, but also the practical steps towards fostering authentic and equitable partnerships that uphold public health values and enhance community engagement. We will also delve into how those collaborations can pave the way for a healthier future, touching on the development of curricula design to equip students with the necessary skills for effective and substantial collaborations. So our panel today, I'll quickly talk about them and then I will turn it over to them. Our panel consists of Dr. Linda Alexander, my fellow colleague at ASPPH. She's the Chief Academic Officer at ASPPH and a wonderful person. And then we have Dean Shafik Dharamsi, the Dean here at the School of Public Health, who I mentioned, Dr. Emily Spence, the Associate Dean for Community Engagement, Health Equity, and the Associate Professor in the Department of Population and Community Health. We are also very fortunate to have some of their community partners here today, Dr. Matt Richardson, who is, he got his training here and is now the Denton County Director of the Denton County Public Health. And we're really pleased to have him. We also are very fortunate to have Dr. Carlos Walker, who's the Director of Family Action Center at Fort Worth ISD. So really fortunate to have this great panel here today. And we're going to go down the line and have each person present. I'm going to turn it over to my colleague, Dr. Alexander first, who will talk about a report that I mentioned earlier this morning, an event that we had here about framing the future of academic public health and amongst many other things, I'm sure. So Dr. Alexander.
So what happened to test 1, 2, 3? Is that better? Now that hasn't done anything for my visuals. I need a little box. Anyway, I'm representing a village comprised of a collaborative team of ASPPH staff leads, task force co-chairs, and our 153 incredible members that we have the honor to serve. I want to elevate a couple of names here because I'm giving this presentation But there are some important people that I want you to know who had everything to do with this report. So our Director of Education, Liz Weist, our Framing the Future Fellow, Victoria Wyant, and the co-chair of the Framing the Future Task Force, who worked tirelessly with Liz and Victoria, Dr. Lisa Sullivan. And I feel a little bit like they were the architects of this new model Rolls-Royce, and I'm the one that got to test drive it. These three individuals had the monumental task of leading, organizing, documenting, synthesizing, editing, and capturing the voices of a group of academic scholars. The end result is 3 visionary published reports that provide critical insights and recommendations as part of our goal to transform 21st century learning and the experience of learning and engaging with students, staff, faculty, and the community. I'm here today to give voice to the recommendations that are a part of the Transforming Communities for a Healthier World report. Please notice the word recommendations in the title. We are not dictating, prescribing, or preaching. We are providing recommendations that are designed to facilitate, manage, and benefit from sustained community engagement. Also, please note that I'm a storyteller by nature. So what I'm going to do in my 15 minutes of fame is to talk you through a bit of a retrospective as I provide examples of how all of the overarching recommendations in that report guided much of my academic research. And earlier today, we talked about that dichotomy, and I'm hoping to demonstrate through my remarks today that it's a continuum and it's a perspective that's important, not either or. And then I'll talk about a mindset approach in about 4 slides that ultimately prepared me for applied practice as a community engaged scholar. Now, you notice that I have this italicized in my title. It's not, my formal title is Chief Academic Officer, but I highlighted and wanted to emphasize today the fact that I consider myself a community engaged scholar. And the reason for that is because I have benefited from the wisdom that communities invited me to participate in. And therefore, the solutions for much of my research was born out of centering the community as key players in problem solving. A measure of success here is that my team and I were often invited back to participate in other events, projects, research, and to disseminate new knowledge. Let me share briefly some of those experiences using a bit of a timeline. In the early 1980s, I was studying non-essential hypertension as part of my NIH-funded postdoc, which allowed an opportunity to work with physicians in Cameroon, West Africa. As part of my entree and acceptance in selected villages where we were collecting data, I drank palm wine with the chief prior to entering the village. The cultural dictated the gesture as a way to be first accepted to talk with the community. In the late 80s and early 90s, I was engaged in what was to become major research emphasis in my academic portfolio, the role of tobacco in health disparities, and at the time, the uptake of tobacco smoking in youth. I was in Texas at the time, where there was an increase in the use of smokeless tobacco in 12 to 17-year-olds. This practice of chewing while playing was particularly popular among Major League Baseball, and Little League players were modeling this behavior. So I spent time on the baseball fields during Friday night games and weekday afternoons with coaches, parents, and Little League players. And at the time, we were even given a big draw by having Nolan Ryan sign some of the softballs or baseballs. Also in the late 90s and early 2002, I worked, excuse me, with county extension agents to develop a curriculum called Walk Across Texas, which helped introduce the importance of physical activity and movement and generated healthy contests between county commissioners, the mayor's office, health department, school systems, with people logging miles for competitive prizes. If you have had the privilege of serving at a land grant or being part of a land grant community, which almost always traditionally includes historically Black colleges and universities in those regions, seek out a relationship with cooperative extension. Notice I said seek out a relationship, not ask for a letter of support when you get your grant. Something I'm most proud of is the organization Colors of Promise. Colors of Promise was created in 2012 in response to African American women in Lexington, Kentucky communities who felt that they were not represented or served by the national focus on breast cancer prevention at the time. They brought their voices to be heard. These are women who were deeply rooted and civically engaged in their communities. A few of us who had also existing roles in the community. I was a part of something at the time called the Health Equity Network. But in my day job, I placed practicum students at the Susan G. Komen office in Lexington. We conceived of an idea to use $5,000 in grant seed money for an education campaign designed by the community for the community. I am a founding member of Colors of Promise, but what I am most proud of is the fact that if you Google, don't do it now. If you Google Colors of Promise, Lexington, Kentucky, you will not even see my name. It is now a 501c3. Many of the original women are still involved, and it has garnered national attention and support from the Regional Cancer Center. A reporter from WKYT in Lexington, Kentucky, Amber Philpott, made it her mission to elevate this work and is responsible for most of our contemporary press coverage. Our work there has saved lives, prevented women from being fired during recovery from breast cancer-related surgeries, helped families heal, provided assistance for medical appointments, provided for makeovers, and prosthetic devices that were racially concordant with our women. After many years of coexisting collaboratively with area hospitals and universities, Colors of Promise has been recognized as a leading voice of cancer prevention in the African American community. The mindset shift here is to think in terms of, did the community get what they wanted? As opposed to, where can you find these results in the published literature? To my knowledge, the outcomes were those that directly centered what the community was seeking. So yes, I consider myself a community engaged scholar. It might also be important to note that while I was engaging in this work over the last 30 years, I was fortunate to be at an R01 intensive research university with the mandates that come with being promoted for tenure. What all of these activities have in common is that the community was centered in all forms of decision-making. There was a power shift in terms of leading the work and dictating the outcomes, and the community determined what was relevant to their needs as opposed to falling in line with grant or university deliverables. I'm not sure that we learn this in our schools or programs to the extent that it leads to authentic community engagement. It is also not necessarily natural for academics to relinquish control and rely on the lived experiences of a community to guide the implementation of plans or outcomes. There is also an important mindset for this work, as I mentioned, and these bulleted approaches constitute the mindset I referenced at the beginning of my talk. It was necessary to do the work that I did over the last 30 years, and it is a relevant starting point for contemporary, authentic community partnerships. And I should have said at the outset, I feel that Dean Dharamsi and Dr. Spence gave my talk earlier this morning. And so I'm really having the privilege of highlighting many of the points that they made. And so you can read, I won't read these slides, but notice this, the words community focus, co-equal partnerships, and the like. What the task force did as a part of these recommendations is help quantify a blueprint of success. These recommendations help to provide a common language and understanding of what is necessary to build authentic, lasting, sustainable, and welcomed interactions with the community. And it helps to center the community in decision-making, goals, and the exchange of ideas and benefits of involvement. Please also note the action words here: position, deploy, develop. The next few slides unpack these action words with very brief descriptions that will inspire, hopefully, a mindset approach referenced earlier to relationship-focused community partnerships. The recommendations highlight the importance of positioning yourself, your team, with relationship-first actions. I want to call out here the importance of learning history, values, and issues. Earlier this morning, Dean Dharamsi mentioned the gravitational pull toward the academic industrial complex. And I think that many of us suffer from that phenomenon if we don't attend to these words: engage, learn, attend, elevate, co-develop, and nurture relationships. This list continues with a focus on recommendation 3. Invest in the infrastructure necessary for sustained community engagement, and integrate, invest, and develop are all a part of this notion of deploy. And I love these action words. I think there are things that we can keep in our mind and we can work toward these things. Investing in an institutional infrastructure, that certainly has been done here to place with leadership and accountability, sustain academic engagement, develop faculty and staff competency in bidirectional engagement. It needs to go 2 ways. And these are more of the action words associated with deploy. Engage in emergency preparedness and response in community protection. And people, scholars, focus on, the lived experiences in community, et cetera. People are saying we need to prepare for the next crisis now. And that was some wisdom. Had the privilege going to a White House meeting with Tim and talking with a group of scientists, and the acknowledgement is we can't wait until we're in the crisis. We need to prepare for it now. Encourage and incentivize community engaged scholarship as well. In recommendation 3, we talk about develop innovative courses for our learners, integrate DEIJ. The focus on diversity, equity, inclusion, and social justice is relevant here with the idea that advancing health equity is a public health mandate and necessary to prepare 21st century learners and practitioners. Also continues with 3 more recommendations. This notion about serving, many of us are in public health because it was a calling, but we can also serve as a hub for learning. I think we're doing that this afternoon. We can co-design curricula with community partners. We heard examples from Dr. Spence about that. And we can prepare learners to meet the needs and priorities of communities. Someone referenced the quote about the students that we have now and what's important about working with that group. And my slide for my new colleague today, this focus on engaging K through 12. Tim and I had the pleasure of visiting 2 of our association members who are at flagship institutions in Tennessee. One is at East Tennessee State University. Dr. Spence mentioned that this morning, and the other visit was to the University of Memphis. And so do a bit of homework after this talk and find out what they are doing to engage K through 12, either directly or indirectly in their work. And we were at these site visits because ETSU and the University of Memphis are the recipients of our own ASPPH Harrison C. Spencer Outstanding Community Service Award. And I think that there's evidence in the things that we're talking about practically addressed in those schools and programs. And again, living beyond the dichotomy of research scholarship or community engagement. And there are very clear examples in that work. I think that engaging our work is, engaging in this work was not our goal at ASPPH in terms of reinventing community participatory action, research. It was not our goal to redefine community engaged scholarship. I do feel strongly that our expert panel, though, provided a common language to begin work that may not be natural up to us or taught to us as part of our training. And we introduced a set of recommendations, guiding questions, and exemplars so that anyone interested can begin where they are or enhance what they have. Please seek out the rich heritage, wisdom, and strength of your communities. Learn their pain and their progress, and find a way to center this wisdom as you continue your community work. Thank you so much for listening and learning with me. I think we're going to save the questions for a bit later,
Right.
right?
Yep, exactly. So I really want to thank you, Dr. Alexander, for an excellent presentation. I also made a mistake earlier. I didn't recognize that the president is in the room. President Sylvia Trent Adams is here, and we're really honored that you are here, and it shows the commitment of the whole institution to this work at the School of Public Health. So why don't we give the president a round of applause? So now I want to turn it over to Emily Spence. Do you want to do that?
To me.
Yes, to you.
To me. It is my great pleasure to introduce Dr. Emily Spence, Associate Dean for Community Engagement and Health Equity, and Associate Professor in the Department of Population and Community Health Sciences here at University of North Texas Health Science Center. And she's going to highlight proposed strategies for positioning academic public health in partnership with communities and how North Texas is doing this through its Community Core program. Emily?
Good afternoon. We are so grateful to host this live webinar with ASPPH and to see so many of our colleagues in the virtual and face-to-face audiences. This year, as we celebrate 25 years of community engagement, I feel incredible gratitude to have been part of these efforts for the past 12 years. I'd like to share a brief reflection of my first year at HSC when I was approached by the Tarrant County Homeless Coalition and asked to help them assess the health and victimization experiences of women who were homeless. They didn't have much in the way of resources to support a study, so we cobbled together a service learning project, an MPH students internship, a DRPH independent study, and a very passionate commitment from community partners who knew anecdotally that there was a problem, but they didn't have the hard data to support it. Our collective efforts resulted in the completion of the Homeless Women's Health and Victimization Study, where we learned of the horrors that women were experiencing while homeless. The findings of that study led to policy changes in the homeless services organizations, the installation of emergency call boxes in the East Lancaster area, the development of a victim advocacy program at the Day Resource Center, and ultimately to several large funded demonstration project grants from the U.S. Department of Health and Human Services and the state of Texas. For me, the best lesson was the synergistic value of combining the three legs of our academic stool: teaching and research and service. On the day that we were presenting our findings to a community audience, I noticed that our dean and my department chair were in the auditorium. I was very apprehensive when I saw them because I feared I was going to get in trouble for doing this free community study. However, after the presentation, Dr. Kurz and Dr. Toombs congratulated our team and expressed that this was exactly the kind of work they wanted to see coming from the School of Public Health. They appreciated that students were getting valuable applied learning experiences and that we were making an impact in our region. Several years earlier, I had been advised that I might be damaging my academic career by doing community-driven research because it takes time to build trust, it can be hard to publish, and the nonprofit community never has enough resources. But that day was when I knew I had found a good home in the School of Public Health.
Last year, we began our strategic planning process with a series of listening sessions with our faculty, staff, students, community partners, and colleagues at HSC. As a culmination of this process, we envisioned health equity in every community and clearly articulated a mission to be a socially accountable, community-centered, and globally relevant school of public health. This plan will engage our students and community partners in high-impact education practices and transformative participatory research and implementation science. The plan reflects many iterations of feedback from our internal and our external partners, and we are so pleased with the way that it aligns with the ASPPH Framing the Future 2030 initiative. We are located in the Dallas-Fort Worth area, which was recognized last year as the fastest growing metropolitan region in the United States. Our 8.1 million residents enrich our lives through cultural diversity, a growing economy, and opportunities to partner on building solutions for a healthier community. Throughout our 25-year history, we have worked alongside our community partners to address pressing public health challenges and have observed some notable successes in maternal and child health, homelessness, health inequities, environmental health, substance use, and mental health. We are particularly grateful for the many students who graduated and became our alumni and trusted community colleagues. Yet, just like the stars above, we live in a dynamic world, and the only thing we can count on to be constant is change. So many of our historical successes have emerged from partnerships that are built on relationships between people. This poses a challenge for developing sustaining solutions because relationships and people are bound to change over time. People retire, people advance in their careers, and sometimes even a pandemic happens to add challenges we hadn't even considered. In addition to these natural migrations, there are some aspects of traditional academic structures that can be barriers to achieving sustainable community partnerships. First, our faculty must juggle the expectation to be effective teachers, active researchers, and engaged partners to the community. The promotion and tenure process for faculty has historically first valued research, and then teaching, and then service. Those who do participatory research know that it takes time to develop relationships, and truly partner on change efforts takes a substantial amount of time. Their career trajectories can look a little different, and the products that exemplify their successful work in communities don't always resemble the peer-reviewed journal articles which have been historically prioritized. In addition to placing community at the center of our strategic plan, we also revised our latest promotion and tenure guidelines in an effort to demonstrate value in multiple ways that community-based scholars can demonstrate impact. Additionally, funding priorities at local, state, and national levels shift over time and are particularly influenced by politics. Taken together, these dynamics have a strong influence on the ebb and flow of academic community partnerships. This has led us to deeply ponder how the structure of our school can support sustainable partnerships and impact. My grandmother always said that we should leave the world in a better condition than how we found it. I think she would be pleased to know that we support a public health student scholarship in her name, and that we are also dedicating our time and our talents to truly consider this question: how can we make an impact that will last through future generations? Last year, we organized a task force of community partners, faculty, and staff to consider how we can build an infrastructure that would center community in everything that we do. It would honor their expertise, their lived experiences, and their vital role in driving solutions for a healthier community. We wanted to move from having a collection of projects and activities that depend on individual relationships to an architecture that centers community partnerships as our default way of doing business. Through 6 months of focused dialogue, our task force developed the Community Core model. This model includes some very familiar components and some new initiatives that will require practice and learning on all of our parts. In its structure, the Community Core is a registry of both people and organizations. But more importantly, it's also a governance process that will ensure our work aligns with the principles that you see on this slide. It is, in effect, one of the ways we are implementing our Impact 2030 strategic plan. I'll stay on this slide a bit longer for you to view the principles and values that were very carefully developed by our task force. From co-learning to cultural humility to shared power and resources, you can see how vital it is for equitable partnerships to be at the core of our core. When you examine the key roles of Community Core members, you might observe that most of these are activities that we've been doing all along. The difference is that traditionally these activities are initiated by individuals and are sustained through their relationships. What is new is the resource support and structure we are building to facilitate these roles as part of our daily practice. When we pull it all together, the Community Core is a model that is administered through a governance board that is co-chaired by a community member and includes representatives from the Community Core Registry, the School of Public Health faculty, staff, and students, and HSC colleagues from outside of the school. Through planned training sessions, committees, and dialogue between academic and community partners, we will foster co-learning, co-mentoring, and partnerships. These partnerships will drive our curricular, research, and workforce development initiatives. One additional component I'd like to highlight is a dashboard built by one of our graduating MPH students, Evelyn Wen. She connected the survey tool that we'll be using for the Community Core applications to a database of public health content derived from all of our course syllabi. This dashboard will allow faculty to toggle through the course content and identify Community Core members who hold practice expertise and lived experience in those areas. This is one of several ways that we are trying to make partnership and collaboration the easy choice. Ultimately, the Community Core is designed to promote alignment between the needs of our community and our educational offerings. We want to ensure that we are responsive to the professional development of the public health workforce. We want to see community-driven solutions that help us materialize our vision for health equity in every community. I'll pause here and you can follow our QR code to read our strategic plan. If you're in the audience, you have it on the table. And I encourage you to follow our Community Core. Its infrastructure is launching now. And I am really excited to see where we head next with it. I'll turn it back over to Tim.
Thanks very much, Dr. Spence. The Community Core is really emblematic of what we're trying to achieve with our Framing the Future report. So appreciate you making that connection. We are now very fortunate to be able to hear from Matt Richardson and Carlos Walker from our community here in Fort Worth. And I'm going to turn it over to Matt first to give his remarks.
All right. That sounds like that works. My name is Matt Richardson. I'm the Denton County Public Health Director. Denton County, for those of you online, it's just north of Dallas-Fort Worth. For those of you in the room, we're just neighbors, right? I'm a very proud alumnus. I got my MPH and my DRPH from this fine institution. And there are so many good things that I can say and likely will say. But there is a focus, and I think it's important, and it's what has been most important to me. I learned an awful lot at this institution in these hallowed halls, if you will. And yet what stuck, what was the catalyst for a career of engagement, what was the beginning, a smittening and then a passion of public health practice was the engagement by the faculty. And what was interesting was, I have forgotten some of the faculty that came preloaded with their own research focus and insisted of the rigor of that focus to be applied to the students in that course. But the faculty that listened to the community and that molded their teaching and maybe their research, maybe their scholarship, when they molded their approach to instruction from a lived experience of the community or a portion of the community, it had power, right? And that power had something else. It had a persuasion to it. And that persuasion crafted and curated public health leaders. Classmates of mine are now public health department directors. They are deans of other schools of public health. They're preeminent researchers and leaders. Some are in uniformed services. I'm very proud of some of my classmates, most of my classmates, and it came from the investment of the school in practice. It just did. It just did. And it changed me. I had a different plan when I got an MPH. I thought my career might take a different path. I still had designs of medical school. And it fundamentally changed the direction of my career and even my life. And I'm eternally grateful for that. And I have been a critic of this school and others as it got away from a mission and a drive towards the direction of applied practice. And when it and we stepped away from trying to implement the successes, the passions and the innovations that the students really bring to this instructional effort, when that moved and got set aside, maybe secondarily, to the interests of faculty, and again, a personalized research focus, I got disengaged. I was doing the public health practice, am doing the public health practice, but things have changed. In the audience, I see Dr. Simbujwe Reeves, again, as a program director for an MHA program, refocusing on community applied knowledge and really the instruction of what the community needs. Dr. Meyer is here from Denton. I'm interested in this even happening at the undergraduate level. Fascinating. Dr. Wagner's here. I see faces of people, Dr. Cervantes, who brings a statewide epidemiology practice career to teach epidemiologists. There's nothing wrong, and I do not disparage research. There's nothing wrong with being a faculty member for your entire career. Those individuals made me who I am professionally. But that linkage, blurring the lines of academic public health and public health practice, we don't want to color outside of the lines. We want them blurred. It's time to ask the what ifs, right? What if we shared faculty in agencies and administrative positions? What if we looked outside of NIH funding and found community agency resources and local intergovernmental agency resources in the 6 and 7 figures, and there's no grant? What if it's an ILA, what interlocal agreement that transfers those dollars for applied knowledge and practice? What if? What if schools of public health across the nation embrace this idea of priority, not targeting populations, but prioritizing listening? What if that process guided what's next? Those blurred lines, right? Isn't this why we're here? Isn't this why you're here eating a lunch? Isn't this why you logged on online? this what's next, the pain and the promise, the pain and the progress of local communities. What if that immersion is instructive in itself, right? If we're good listeners, as Dr. Alexander had said, if we're good listeners, the research is plentiful. The publications are endless, right? The data analysis, I promise there's plenty of stats to be had in community project and programming for practice. I'm passionate about it. You can hear it. You can see it. I'm inflexible in my insistence in this institution because I'm an alumnus and I feel I've earned the right, whether I have or not. I do not care. I feel that I've earned the right to insist on making it part of the instruction to help others around us. That's not unique. That's not, I certainly haven't planted this seed, right? Academia has been attempting this for a long time. I mean, this is why people go into teaching. This isn't new, but it is time for a refreshment and a reset, right? I was having lunch with Nancy. Nancy is recently retired and an accomplished nursing leader. Well, the school, I don't know if the school has, you're here. We need to leverage Nancy's knowledge, right? Something needs to happen with that lived experience and this legacy of teaching and learning and doing. Ashley is working at a community health center in North Fort Worth. I just met Ashley. Ashley's a nurse, right? Ashley's doing maternal child health. Hey, and listen, if you're in academic public health, you know the challenges of African-American women, disenfranchisement, systemic racism, and the effects it's having on babies in hashtag 2024. God forbid we ask Ashley how we can help, right? Ashley's doing it. I'm paying attention. She's not in my county, but you know, they're going to help. We need to listen to Ashley. We need to listen to Nancy. We need to focus on these. And it's the word partnership. Roll up the shirt sleeves and be an active academic listener. And the instructional and the research and the publication opportunities, I promise, are endless. I want to be part of that conversation. I hope you do too. And maybe we can kind of reframe why it is we do what we do, why we teach what we teach, why we study what we study, so that when we put our head on our pillow at night, it's a little easier to go to sleep, right? We're part of that change, as Gandhi says. We're part of the change we want to see. God forbid we actually put the meat on that bone, right? Okay.
Thank you. Thank you
Linda,
so
that's
much.
what I have. Tim, that's all I got.
Well, and before, when I met Matt, he's like, oh, I'm just going to wing it. Well, I think that he didn't just wing it. He really has incredible ideas, but he also incorporated many of you in the audience. So I'm impressed. Okay, now we are going to turn it over to Dr. Walker and hear his remarks. Thanks very much.
I think I should have went first.
No.
Well, I'm gonna make up from some time. Good afternoon. My name is Dr. Carlos Walker, and I'm a Fort Worth ISD employee where I grew up here in Fort Worth. I've worked for Fort Worth ISD for the last 22 years. And I love the experience that I have here working with UNT Health Science Center. I'm not gonna say too much because we actually have some questions going forward. But so once we get into the questions, then we can talk a little bit more about what I do.
Great. And Dean, it just is occurring to me now that we didn't actually have you giving a presentation. You could be part of the Q&A, but I can't let the Dean not have a few minutes to say a few words.
You know, the dean doesn't always have to be at the podium. The work that we do requires a collective effort from our faculty, from our team members, and all of the heavy lifting happens there. And our community partners alongside our faculty members under the leadership of our Associate Dean for Community Engagement, they've been doing a lot of heavy lifting around the community core model. And that model is a result of what is unique about what it is that we're doing. Not very much, but perhaps except for us expanding our thinking and our understanding of the concept of shared governance. Shared governance in higher education and in academic settings is a key feature of how we operate. But we are a public institution. And our community partners, our health sector partners, society has a stake and a voice in what it is that we do for their benefit. And so one thing that's unique about the model that we want to move forward is that we want to integrate our community partners in the shared governance process. And what does that mean and what does that look like? Well, our learning activities, how we shape our curriculum, how we teach and what we teach, although it's within an accredited framework and there are overarching competencies, but how we do that, I think can be informed by our community partners, because ultimately our graduates are going to serve them. And if our communities don't see abilities in our graduates to respond to their needs, then we will have failed. Shared governance in the role of the community in our research enterprise, our research plan, our research focus. What should we be focusing on? We should be focusing on research that responds to our community's needs. And more importantly, the application of the knowledge that we generate. We generate, how many millions of journals and articles do we generate? And how much of that really goes to inform policy and practice? And so our community partners would be involved in shaping our research questions, our research focus, and then being co-participants. By the same token, in the curricular process, being co-educators. That's what the community core model seeks to achieve. And so that's going to be key. And ultimately, what's most important is if you're going to get something done, you're going to need resources to have it done. So our community partners in the shared governance process would also have a voice in how we allocate resources, right? And that's going to be key. The provost and HSC has played a key role in investing in the community core model. It's part of our budget. It's part of our DNA and our infrastructure. So I wanted to highlight those three things within the context of a co-equal partnership, right? It's deeply embedded in everything that we do as an academic institution. And it extends this key area that we value so much, shared governance, and extends it to community, not because we're doing them a favor, but because it's our fiduciary responsibility.
Yeah, thank you so much for bringing that back to the discussion here, Dean. I appreciate it. So maybe much to the chagrin of my colleague, Liz Mace, I'm going to go out of order because that's my nature, and I'm not going to let Dr. Walker get off so easily. So I'm going to ask you if you can talk about sort of the most effective strategies you've seen in terms of engaging families and local communities in public health initiatives.
Okay. So now that I have the floor, basically UNT has already been doing a great job of that as far as when it comes to engaging the community and the families. I think about when we first started working with UNT Health Science Center, we were actually working on infant mortality issues in the 76105 area. And so that's where we actually started. That's where I met Dr. Spence. And from there, we continued on the work. We had an organization or a committee rather called the Family Engagement Action Team. And through that particular committee, we actually engaged parents of our kids who were having difficulties in school, because those are the parents that we want to make sure that we're engaging, because those are the voices that are usually lost within the school system. Their kids, a lot of times those parents are the parents who were not engaged in school themselves. And so when every time the school calls, it's like, okay, here we go again. Now they're bothering my kid. And so this was an opportunity for those parents to actually have a voice and to be heard by the administration, by other organizations as far as nonprofits that were a part of that particular committee. And so we actually took that work and the publication, and Forest ISD wrote a grant to TEA, and that work was continued through the 76119 grant. And actually TEA made that a model for the state of Texas. And so that started right here in the 76105 area. So that type of work, also working with the Faces of Changemakers, which is a group that we're currently working with. And that's led by Roderick Miles with Tarrant County Commissioner's Office, Precinct 1. And so that work entails actually, it's trauma work. So basically we engage with our churches and we actually talk to them about trauma, the impacts of ACEs on their lives. Because the goal is to actually break the chain, you know, to stop the generational passing down of trauma within the families. And that work started actually with working with UNT Health Science Center and Dr. Emily as well. So those are some of the partnerships. Also, my department had the opportunity to have 2 interns to work on actually doing some community asset mapping for us after COVID. So we know that there are a lot of churches over in the Stop 6 areas, East Fort Worth area. When I first became a principal over there, we had about 140 churches that were actually on the roster. After COVID, with our interns going through the list and actually seeing what churches were still active, we have about 60 after COVID, you know, so that was an opportunity for us to learn what their ministries are about as far as, can we send people to your ministries for different things? Also, they were able to vet our nonprofits as well that are working in the area as well. And so I had them to look at the 76104, 76105, 112 and 119 nonprofits. And so they generated, their project was to generate a list of those nonprofits and what they provide to the community where we can actually engage those nonprofits. And so all that came through UNT Health Science Center. So when I'm hearing the 2030 plan, it's like you already are doing the 2030 plan. So I guess this is going to be 2030 2.0 because the work is already happening. And I think the biggest part is you all come into the community and you listen first. And you actually give them opportunity to let you know what their concerns are. Because that's what I hear mostly from community members. People are not listening. They want to come in and tell them what they need, but they've never walked in their shoes before. And so that's right there, you've lost all the trust when you come in and you do that. And so we've been fortunate where they love Dr. Emily coming in because she's asked a lot of questions, you know, and so that gives them opportunity to tell them exactly what's going on. And so she takes that data and she actually put it in a nice report. And especially when, you know, it makes a difference when you talk about acknowledging people and they see their names in these reports, that really empowers them and they take ownership of it. And so at that particular point, community members are saying that it's theirs and they are actually the ones that are actually implementing the changes that we want to see as a whole. And so having UNT Health Science Center as a partner really elevates the voices of those the most in need. And so that's how I see it. And I was glad to be a conduit as far as to having access to the parents as a Fort ISD employee, but also having access to you all that have more resources and more opportunity for us to really take it to a deeper level, because Fort ISD, we really focus on the academic side. And so my department is fortunate enough to focus on the community side along with the behavioral health. And so that's really how you engage community. And I also want to say that I graduated from UNT up in Denton, but I took a lot of classes here. You talked about statistics. I took statistics here at this campus. So, yes. Thank you.
I knew you had a lot to offer this discussion, Dr. Walker. Thank you so much. We have about 7 minutes left, and so I want to give the audience in the room first a chance to ask a question. If there's a question someone has, please come to the mic. Okay. Oh, you would like to ask a question? Can you come to the mic, please? Ashley.
Hello. I just was interested in the listening parties that you had. How did you get the community to come? Because I don't know how to incentivize. I work with moms and I want to know what they want versus what I think. I want to do that. But I don't know how to, you know, how do I get you to come to the listening party? How did you draw the parents to have those conversations to get that started?
So a lot of the parents, actually, they were looking for an outlet. I mean, they were upset with what they were seeing. I can say that at the time when we were doing the family engagement, Fort ISD was going through some transitions. And so parents were upset about, you know, you guys are saying that we're not engaged, but you don't know how to engage us. And so that's when the conversations were like, okay, so how do we engage parents? You know, what are the best ways? So will you be involved in a focus group so we can have these discussions, so we can learn from you all how best to engage our parents? And so we had about 7 or 8 parents that volunteered their time to participate, and they were there on a regular basis. They did get a $25 gift card, but I don't really think that was the driving force. It was more of their voices were being heard. And it also gave my department an opportunity to work with those parents as well. And so as a former principal, I would go in and talk to the principals and work with those parents with their principals and things that were going on with their kids. So I think just empowering them and them having someone in their corner and knowing that their voices were being heard and seeing some action behind just the talking as well.
Thank you.
Great. Liz, are there some questions online?
This person was anonymous, but sorry, get back to it. Can a public health nurse work independently in a public health community?
So I'll just say from a local governmental perspective, I'm not sure the essence of the question. I like public health nurse. I like in the community. I don't know independently. I would almost, that may be a practical question, but I would say in general, we would want a public health nurse to be a part of what Dr. Walker is talking about, that what if a maternal child health nurse, someone who works in one of my clinics with moms, what if she's part of those listening sessions as well? That what if the moms talking about their needs, talking about barriers, talking about places that the system makes them stump their toe, what if we can make that better from a clinic side and then from a public health nursing side, and then, God forbid, what if that public health nurse was part of a nursing school faculty at a university like this? What if that lived experience of public health practice in a clinic like mine, a clinic like Ashley's, gets that experience? What if she's part of the listening at a Fort Worth ISD event? What if she's a conduit of access for these moms to get to the existing resources? And what if she could teach other nursing students how to do that? Right? Like that's the magic. So the independent, I think that was the part of that question. I don't know, working independently. I think this is about us not seeing ourselves as independent. Let's contribute as part of a greater body. So instead of a free agent, what if we could contribute to a systemic improvement? That's a big ticket thing. I mean, that's a lot. But what if we could do what we could see our careers as part of that?
I want to add to that as well. We have a lot of nonprofits that could really use the manpower of a nurse when it comes to educating our kids and as well as our parents. We have high rates of child obesity. When you talk about the public health effects of that when it comes to high blood pressure and diabetes and those type of things, that's where a public health nurse can come into play when it's working with these organizations as well.
So unfortunately, I think we're going to have to wrap it up here. I really appreciate the audience participation. I really want to thank the University of North Texas Health Science Center School of Public Health, and especially Dean Dharamsi and his team for hosting us here and really exemplifying what we're trying to achieve in terms of community engagement. I want to thank the whole panel. Can we give them a round of applause? And we thank those online as well for participating, and we'll look forward to the next ASPPH Presents event that you can tune into as well. Thank you.